I'm Steve Singleton. I now live in Eastwood House in North Yorkshire. I'm 64 years old, and I've been married coming up for 40 years. I have 3 daughters, all who are just in their 30s. My youngest is coming up 30, and I have 3 grandchildren. In November 2016, I went to see my GP on a Monday. It was the week after my birthday. I'd had a couple of bouts of diarrhea, which was something that after 30 years doing shift work, had never bothered me. I could eat when I needed to, sleep when I needed to. So my wife said, best you go and see the doctor, which I did. He wasn't overly happy, sent me for a scan. And the radiologist who did the ultrasound got rather flustered and said that I needed a CT scan. That was booked for the next day. And then on the Friday, 25th of November of 2016, so that's 9 years today, I got the phone call to say, present yourself to the nearest hospital as soon as you can get here. I was admitted as an inpatient. I had 10 days of tests, and the consultant finally came back with what they thought was the right pathologist decision. Apparently 3 pathologists looked at the biopsy. They all had a different view on what was occurring. They did agree it was large B-cell, but where it was on scale, it was a split decision. He said, you're going to start chemo as soon as we can get you going. I think 2 days later, I was transferred to the chemo ward, and I had my first dose of chemo early December. At the time, I don't know if you remember, there was a series of adverts where people were being given the news they got cancer, and it was almost like they pulled the plug out, they just deflated. I was like that. It's one of the worst couple of hours of my life. Because I had to tell the kids, tell my wife, and then tell my parents. And then get myself to hospital. And after that, it was just basically hang on to the doctor's tail cuts, hope that they got it right, and take one day at a time. Gardening business I had to give up. Gave it to a mate of mine, because physically I just couldn't do it. And once we got into the rounds of chemo, I was drained every 3rd week. You start on the chemo, and the first week it's just like, I'm wiped out. And then you start to feel a bit more human. Get to 3rd week and you're back to your normal self. But by the end of the 3rd week, they're sizing you up for the next round of chemo. So yeah, from that side of it, it was a challenge. Well, 2 of my girls were away. One was in Exeter, one was in York. They were upset. I think everybody feared the worst. But once I got the diagnosis, and once the consultant said, this is curable, this was after my girls had given the 3rd degree. They're all university students and what have you, so they've done research around cancer and treatment and what have you. And to be quite honest, I felt sorry for the blokes. They gave him a bit of a hard time. But once he said, you are curable and this is what we're going to do, for me, that was it. There was a plan. And I just said, well, get on with it. Just bring it on. Social life took a bit of a blow. People would pop in and see me. There were times when I couldn't. I just wasn't up to socialising. As the treatment progressed, we went out for an occasional meal on those periods when I was relatively fit. When I felt, the chemo. The further you got away from chemo, the better you felt. The girls brought Christmas forward because they didn't know where my treatment was going to be. I had a round of chemo between Christmas and New Year, but got over that, get into that middle week, and I would try and take exercise And, I'd start with a couple of days just to sort of getting around the park, which may be half an hour, 40 minutes, but it was getting out and getting fresh air. And then as the week went on, I'd go further and further afield. So it was just walking exercise. It wasn't anything overly strenuous. But, that, I think from a well-being point of view, that helps, being able to get out and get some fresh air. My wife is a clinical nurse specialist in heart failure. She is able to interpret what the medics are saying. She's obviously got insight into that, whereas I clearly haven't. I'd sit there going, right, okay. She had a sharp intake of breath, and her response was, "But he looks so well." I was about 4 weeks out of chemo, so I was feeling better, but apparently the scan results weren't favourable, and I just basically said to the consultant, "Right, okay, so what's next?" And she did her best to explain what the plan was. Obviously, when you've had a consultants meeting, everybody wants to know what's occurring. My view was, I only communicate the positive. I always try and pick the positive out, and I ditch all the negative. There were small positives, and they were the bits that I hung on to and basically kept my family and friends up to date with. Well, the link nurses, by and large, were the most helpful, especially when they were on duty. And, because they could keep the information flow going. I mean, there is online stuff, and I did dip into some of the support group stuff, like, your Macmillan's chat rooms, that sort of thing. I did dip into those. I didn't really get involved in one-to-one conversations with people other than my wife. I didn't want to get involved in that side of it. There was information there. I took it on board. I did some research. We looked at the drugs that I was being prescribed, and the rest of it. I think the main sort of crutch would be the link nurses, because they would talk to you in plain English. Well, the emotional support came from the family. From an actual practical point of view, I think it was very much a case of we learned from the experience as we went along. For example, after probably the second round, I knew when I was going to be feeling rough. I knew when I would be able to do stuff. I knew when I needed to rest. And there were times when I wanted to do stuff, but I just couldn't. I just didn't have the energy. It was more we learned as we went along. From a practical point of view, I learned that not to have chili con carne on the same day that I was having chemo, because it's not nice when it's on the rebound. Your diet needs to be bland when you have the chemo days, just so you can keep it down. If the link nurses were on duty and contactable, it was usually pretty good. If they were off duty, you had to leave messages. What I did find with some of the consultants, and I've discussed this with my wife because we're all guilty of it. I mean, we used to do the same in my job. I'm sure every large organisation has its own language, and that's job speak. Okay, so the consultant would talk to you, and you'd be going, right, okay, probably like most patients, and the consultant would obviously go into, job speak language, and not necessarily, and I was fortunate I had Mars with me because she can interpret what that consultant's saying to me. And then you go, right, I'm sorry. Well, not the better consultants, but the ones that are more patient focused were able to communicate in plain English. But when you have clinics, I mean, I was in a large clinic to start with. you don't necessarily see the same consultant time after time. You know, you might see 2 or 3 are all in the same. So that's a little awkward, because you've got to try and pick up the way that consultant's communicating with you. They talk in such a manner that's too high. It's too high a level. You know, I'm an ordinary bloke, and unless you've got, you know, a medical degree, you probably don't understand what they're saying. Every day is a bank holiday. Since I got the all clear, I've walked 2 of my daughters down the yard. I've got 3 grandchildren. I've managed to run 5 half marathons. My wife and I have raised £8,500 for Blood Cancer UK. And I just try and basically take every day as it comes and do something positive.